Thank you, listeners, for joining us. Elko Live today features guests from our professional community in talking about an opportunity for women's wellness. We're so pleased to feature our guest, Terry Clark, who is Director of Growth and Outreach from our very own Northeastern Nevada Regional Hospital. Welcome to the program, Terry. Thank you.
Love being here. Thank you, Lori.
Oh, it's great. It's just wonderful to see you, Terry, and catch up on all the exciting things that the Northeastern Nevada Regional Hospital is doing. And then Courtney Nalivka is a dietitian in our community. And Courtney, it's been a while since we visited, but what a pleasure to see you again.
Yes, it's good to be back. Thanks for having me.
Well, thank you, and happy spring, ladies. So, well, spring is a time of renewal and hope and health, we hope, and that's what is going to happen with the wellness effort that the hospital is launching. So I understand, Terry, from you that this is just the first in a series with a special event coming up. If you wouldn't mind telling us about it.
Yes, it is. We had decided at the hospital that one of our priorities for 2024 is going to be women's wellness. Women's health is one of those things that I think and know from personal experience, it's so easy to put on the back burner. There's so many priorities. Life is so busy. And what we're trying to do is help raise the awareness of how important it is for women of all ages to take care of themselves. And we are doing that through a series of, just fun events. This is the first one, kickoff, Ladies Night Out. We will do a couple more throughout the year. This first one is going to be on April 12th. That's a Friday night. So ladies, grab your girlfriends. It's at the Western Folk Life Center. Doors will open up at 5 o'clock. We've got food. We've got food, drinks. We've got mini classes. We've got demonstrations, cooking demonstrations, and tasting, vendors. It's really going to be a fun time.
And I know that's where some of Courtney's expertise comes in, because there are so many stages of a woman's life where she needs a little more support. And we might find that with better diet. Certainly we hear the E word, exercise, a lot. But there are things that we can do to make it fun to get out and get moving. Right, Courtney?
Absolutely. And that's one of the things that I hear commonly, or we hear commonly in our practice, is how hard it is to eat healthy and to live a healthy lifestyle. And we want to take that overwhelming feeling, that stress, that hard feeling out of trying to live a healthy lifestyle, because the things we do now make a difference in our future. So we want to make sure that we're finding those ways to be healthy now. Even as busy as we are, even as crazy and hectic as life can be, we need to make our health a priority, because we can only be the best version of ourselves when we take care of ourselves first before others.
I hear that analogy, and for some reason, I just think of it often, especially when it comes to women. And when Olivia was still a child living at home, you have to put the oxygen mask on yourself first, right? Mm-hmm. So your health and nutrition is just as important as that of everybody in your family. And Courtney, being a dietitian, and I've seen you in the grocery store, and I think that that's part of what you do sometimes, right? You help people understand how to navigate things like the grocery store.
Absolutely. Yep. So anything from learning how to shop, learning how to read a food label, learning how to incorporate your nutrition goals into traveling, into the busy season of spring sports with activities. We just help our clients and meet them where they're at, so this factor of eating healthy doesn't have to be hard.
It can help you with stress. It can help you with anxiety, any number of underlying health issues before they actually become critical health issues. And so back talking to Terry, again, this special event, the Women's Wellness Series coming to the Western Folk Life Center. This first emphasis is going to be something that's so crucial to our community right now, Terry. You'll be introducing some wonderful providers, and some of them are new to the community, focusing on women's health, right?
That's right. We have, one of our classes, for example, is going to be, and she's not new to the community, but Janine Anderson, a nurse practitioner who works in our cardiology, our heart clinic. Janine is going to be giving one of the mini classes about stress. And it's not just, okay, we all know we have stress, right? I don't need a class to tell me I'm stressed. But what are the strategies I can do to reduce that in my life? How can I take this on? She's going to be there teaching. We're also going to have Dr. Callie Blair around. She's coming to visit. She'll be visiting. And we also have a new provider, Dr. Cooper Simon. We hope they're there. Now, let me just say this. Both of these ladies are OBGYNs. They may be at the hospital at the time, but we're hoping they can make it over there if little babies don't need them immediately to take care of that delivery. But we're excited to have our providers joining us to meet people. I find it interesting, these ladies, these providers, they are such wonderful, down-to-earth people. I've always thought, women's health, Courtney, you were just talking about, people find it hard to live that healthy lifestyle. Somehow in my mind, I always thought if you were a provider or a doctor, it would be easy for you. You know what? I think it's tough for everybody to make it work. But those strategies, they've just learned strategies of how to incorporate these things so they become a little bit more part of your natural life. And that's where habits start forming. It takes a little work in the beginning, but what I love about these people is these ladies and these doctors, they get it. They have busy lives, busy kids, and they understand. And so the strategies that we're going to be teaching or talking about, they've been vetted in real life. They work.
Talking with Terry Clark and, of course, Courtney Nalivka, and they are our guest today. Women's wellness is the topic, and what is also really nice about this, Terry and Courtney, is that this is really for ladies. It is the ladies' night out, but the strength that you can find in the support from other women. I can imagine there might be new moms coming to this Wellness Wednesday. There might be women, going through menopause. There might be elderly women there, but we can all share experiences and talk about the real impacts of everyday life on our health.
That's right. I think that sharing, just knowing Courtney, we used to work together, just sharing ideas and experiences. I love it when someone says, yep, that sounds about right. I just turned 60 on Monday, and I never realized how much your body changes from just even 50. So all of those young ones out there who are going, that's still very old. Now 50 seems like young at the moment, but those changes happen. And one time I was in a conversation with Courtney. She said, yeah, you need to, do more strength training. And I thought, okay, see, it's not just me. I am getting a little weaker. It felt good to have that camaraderie of someone else just validate what you're going through and even just chat with you about it.
And Courtney, I'm sure you find that maybe some of your new clients, people that you consult with as a dietitian, they may be new to the community or feel isolated. Elko's quite a distance, and we have a lot of people here that have come great distances to follow their family, say in the mining industry. So I guess it could really help, again, having this camaraderie, talking about women's health. What is the best foundation to stay healthy? And even in a rural community where we can't just run out and pick an apple, right?
Absolutely, yeah. Yeah, and part of that is being successful in our health, in our individual health journeys, is having accountability. So whether that accountability comes from a friend or a family member or somebody you meet at an event who is relatable, you're going through the same experiences, you're struggling with the same challenges, that accountability is huge when it comes to actually implementing the changes necessary to live a healthier life.
So there might be ways that some of the women that attend this, the Women's Wellness, the first in the series on Friday, April 12th, you could form some networks if you want to shop at the grocery store together, so that way you can help each other. Because I don't know about you, sometimes I go to the grocery store and I'm hungry and I bring home all the weirdest, worst stuff, right? And then,
Yep.
yeah. So networking, maybe have some joint grocery shopping trips together to help each other. Do you know there are a lot of younger women especially that they've never really cooked using recipes, right? Have you noticed there's kind of a generation gap, Courtney?
Yeah. We're going towards Instagram or Pinterest for recipe ideas and not using our recipe boxes or recipe books that we have at home. And there's nothing wrong with that, but it is a different shift in how we cook.
Yeah, and there are definitely healthier sources and sites to access, right? Because a lot of processed food, I see some of the easiest things on Instagram and I think, oh boy, I don't think I'd want to ever put that much butter in something. But yeah, because they make them tasty, but full of salt, full of fat, right? Full of carbs.
Yeah. One of the fun things that I really like to do is to take one of those recipes, say it's a family recipe that's been handed down and it's maybe not the healthiest.
It has lard in it.
Yeah. But we find ways to tweak the recipe to make it a little bit healthier, so it's something that you won't feel guilty about eating, or the next day you're back on a diet, and still be able to maintain the tradition of the grandma's recipe that you have.
Oh, what a great idea. That's another opportunity, again, for the networking that you'll find at the Women's Wellness Series. I can tell I sparked an idea for you, Terry. Yeah.
Yes, as we were talking, we are really fortunate to have two of our dietitians from the hospital will be there as well. And they are going to be demonstrating 3 different times, three different demos, easy, quick recipes that you can put together really fast. You can keep them in the fridge or throw some in the freezer. And what's great about demos, I like to see someone throw it together. If I can see it, it's a little bit easier. You'll walk away with recipe cards, but there's the things that they are fixing, and I'm going to let it be a surprise. Let me just tell you, they're good. These are delicious, wonderful. You don't even know that you're eating healthy. And that's what I love about this whole series. We're starting to uncover new ways that we can still have maximum enjoyment in life. You can really, treat yourself and feel like it's a treat, not eating cardboard, which I've done that before, saying this should be good.
Yep. Well, from those delicious desserts to, of course, the mainstay and recipe ideas, this sounds like a terrific opportunity, again, in the first in the Women's Wellness Series. And Courtney, are there particular things that you might be adding to the event that you want to make sure you emphasize today?
Yeah. So, again, going back to the common theme that I have heard and we've heard in our practice is it's hard to eat healthier. And then it just creates this more stress and this feeling of overwhelming, like, I don't know how to do this, but I know I need to, or my doctor told me I need to follow this plan and I don't know what that means. So I'm going to be going over some simple ways to take that stress out of eating healthier and make it more practical, make it more doable, finding those ways to simplify your life so that you still have healthy options at home, even during a busy week. So I'll be kind of going over some tips just to, make that eating healthy feel less overwhelming and less stressful.
I remember too, Courtney, visiting with you, a busy mom, and that you had strategies too for helping kids be helpful in the kitchen, right? Involving your family in the process, so you don't feel like you're the only one caring and doing everything, right?
Yeah, I am a full believer in incorporating the whole family into the process because, number one, it's a teaching tool. So you're teaching your kids how to eat healthier, how to plan a meal, how to cook. You're getting their buy-in, and when you want to try a new recipe, if they've come up with the idea, they're a lot more likely to try it. And it's a family activity and take some of that burden off of mom.
So you're going to find some of this inspiration and more at the first ever event hosted by the Northeastern Nevada Regional Hospital. It's the first in the series, so you don't want to miss out on the Ladies' Night Out for Health. It is sponsored by the Northeastern Nevada Regional Hospital, but it does include our local professional medical experts and others who are contributing. Friday, April 12th from 5 to 7:30, Western Folk Life Center. Get a sitter because it's going to be fun, ladies, and we can just kind of mix and mingle and talk about any number of subjects. And I would suspect, too, that along with the catering by Ogie Deli and the door prizes and giveaways, the cooking demonstrations, the health tips and fun, that maybe some of our conversations might help guide future sessions.
Definitely. We are always looking at what your needs are as far as, our patients. We talk to them all the time. We talk to community groups. We want to know, what are you struggling with? And as healthcare providers, we want to know, how can we support you? What can we do to make your life a little bit easier? And so that information that we get from chatting with you, from you coming to these and giving us feedback, we are going to be doing this several times a year. And the next one will be coming up in September, and then one again at the end of the year. So we'd love to have your feedback and inspiration of where should we go with this.
Sounds great, Terry. So what's the best way? Because you are asking folks to RSVP.
Yes, and that will help us know how much food to order, and just logistically, we're not going to turn you away if you forgot to RSVP, I'll tell you. But it would really help if you could. There is on our website, nnrhospital.com, a quick link. Just click on there and all the tickets are free. You can order several for your group at one click. Or you can let me know. My email is Terry, Terri, Clark, CLARK, @lpnt.net. And I'll reserve your tickets for you.
That sounds great, Terry. Thank you. Again, the Women's Wellness Series, ladies, it's for women in all stages of life and health. If you have questions, if you have concerns, this is an opportunity to meet in the same room and to meet with some professional medical healthcare providers. As Terry said, circumstances permitting, if there aren't babies happening right at the moment, you'll get to meet some new or some existing OBGYN providers right here in Elko. And there are some amazing teams of people here delivering babies, prenatal care, ongoing support to patients in pediatrics. The Women's Health Clinic will feature Dr. Gwen Cooper Simon. That is one of the professionals you're hoping to have.
That's right. Dr.
Great.
Cooper Simon. She's an OBGYN, and she does women's health of the whole spectrum of ages.
So sometimes people think of OBGYN as just delivering the babies, but really this is for women of all ages. If you're perimenopausal, postmenopausal, menopausal, ladies, it's time to have these discussions. It's just time to have these supportive conversations about how it makes you feel and what you're experiencing and where you can find support, because I'm convinced it's different for every single person.
I agree, and I love what Courtney brought up, that there's a spectrum, and what you do, the earlier you can engage in healthy habits, how much difference it makes down the road. And you can speak to that from your clients, I'm sure.
Mm-hmm. Yeah, we like to work with clients on the younger end of the spectrum. I'd say probably premenopausal, but by incorporating these habits now of strength training, eating well, getting enough protein in, getting a well-balanced diet in, it will make the process of going through menopause easier. May not be easier, but it may feel a little smoother. It may feel like your body's not changing as much because you've already started some of these habits ahead of time.
You have a great foundation. And plus just having the conversations, I think that's reassuring to people too. And the whole family can understand. If you have a supportive spouse, that makes a huge difference. It's just like anything else, whether it's, colon cancer, breast cancer, heart conditions. We just need to have these public conversations so that we can be healthier going forward.
You bet. And you don't have to wait very long to see the benefits from it. I remember as a young mom having making just some minor changes. It wasn't even a big change, but getting out and walking every day. Just those small changes, how much difference it made, not just with me, but in how I interacted with my family and how did I manage my children and stress, and just life was better with these few changes that a good friend of mine encouraged me to make.
Very nice. Speaking of friends, you might make some new friends too at this event. It's the first ever Ladies Night Out for Health, hosted by the Northeastern Nevada Regional Hospital. It is coming up on Friday, April 12th. I wanted to make sure we're going to look over some highlights too, some ways that our hospital has been giving back to the community, doing some extraordinary things. And then there are some exciting plans that we also want to talk about. But I want to make sure, Courtney, that we got to all of the issues that you were hoping to highlight today on the radio show. You're welcome to come back anytime, by the way. Yeah.
Well, thank you. Any chance. I love teaching and I love educating. So the more I can spread the word and share my passion and make it easier for people, that's what I like to do.
Well, I've seen you collaborate with a lot of different agencies, organizations in the community. What is the best way to reach you? You do work independently, so.
Yes, so we're a group practice, Last Stop Nutrition. There's 3 registered dietitians on our team. 2 of us are local, so myself and Jody Allen. And then we've actually got a virtual dietitian that has joined our team from Georgia, and she is also taking clients and seeing clients on the East Coast for us. So best way to reach us, we have a website, www.laststopnutrition.net. We're also on Facebook and Instagram at Last Stop Nutrition.
Very nice. Now, Courtney, ways to pay are various insurance, or how do you adjust that for people? So I've never seen a dietitian. I don't know anybody listening who's like, oh, a dietitian, what a good idea.
Yeah. So we do not bill insurance. We offer our programs as a package. So we're working with clients for a minimum of 3 months, sometimes up to a year. And we offer a lot of in-between support. So support between our face-to-face sessions by reviewing food logs, doing check-ins, that accountability piece, providing any sort of resources, menu ideas, meal plan ideas. And that piece is where insurance doesn't cover. So we bundled it all together in one supportive package. And that's where we found our clients were getting better outcomes when we could be literally in their back pocket. They could message us, they could ask a question, we could provide a resource, we could help them troubleshoot the situation they're in and keep them moving forward in their journey.
Wow, what a great idea, Courtney. Thank you. And again, for being accessible in that way, laststopnutrition.net. That's the website. Find out more. If, for example, you're listening and you got your lab results back from the recent health fair that was in part hosted by the hospital, and it shows that you're pre-diabetic, well, you need to maybe talk to Courtney and her team, right?
Yep, absolutely. And the reason we call our business Last Stop Nutrition is a lot of times we get clients who have tried everything. They've tried diets, they've tried detoxes, pills, supplements, injections, all the things, and they're still not finding those results that they're looking for. So we are the last stop. We are Last Stop Nutrition, and we are the sustainable approach, the lifestyle change. So maybe it's not as glamorous, maybe it's not as fast results, but it's definitely the more sustainable route to get those long-lasting results. And like Terry said, still being able to enjoy food and enjoy life and not feeling like you're restricting or depriving yourself all the time.
That's great, Courtney. Changing up again the way people are thinking, how we're feeling and acting. Even here in rural Nevada, Northeast Nevada, we have some amazing resources at our disposal, Courtney. So next up, life coach, it's all part of it, right? Thank you, Courtney, very much. Courtney Nalivka, she is a dietitian with Last Stop Nutrition in our community. And now back to you, Terry, as we're going to wrap up today's program. We have plenty of time, by the way, so no worries about that. But Northeastern Nevada Regional Hospital has been doing some amazing work in outreach in the community. There's some exciting prospects on the horizon. We do see Steve Simpson, your CEO. He's been appearing at public meetings. He went to the health board. He goes to the health board, I think, regularly and gives the county commission updates. But it's pretty exciting what the hospital's involved in.
Yes, and you mentioned Steve Simpson, and this whole idea of a women's wellness series was kind of a brainchild of he and Steve Burrows. Those of you who know Steve Burrows, myself, we were sitting and visiting about how could we better help the community. If you know Steve, you know that he is genuine and authentic. Just I've always been impressed with how kind and good he has been to everyone. But also, I love the way he talks about his sweet wife and his daughters. So, women's health, that is very near and dear to him. And so this is not surprising at all that when we suggested this series, he was all over it. Very supportive, as was our Chief Nursing Officer, Becky Jones, and Del Guffey, our Chief Financial Officer. The reason I'm telling you this is because this hospital is not a facility, it's people. And the people who are managing and administering and working and taking care of patients and cleaning the rooms, those people deeply care. I work there, I see them, they deeply care. And that gets reflected in the programs that we have out in the community. This is one of them. They support many others. Most programs are not of ours, but we do help in some kind of aid or need, or those who have need. There's $18.8 million that was distributed in 2023 to people in need or to programs serving people in need. That's a lot of money from a rural community, a rural hospital, and we're proud of it. It's not something that we take lightly. We are very proud to say we engage.
You're right. In LifePoint's overall mission, as 18.8 million in services, and what Terry is talking about too, there are indigent people that need emergency care or extended services in the hospital, and that's all contributing to that. The county contributes a relatively small amount, but the hospital is not turning people away. And there are so many different aspects. In fact, one area of great care right now in the community is behavioral health. And I wanted to let you talk about what's coming to NNRH, hopefully in the fall.
Yes, we are super excited. It's a behavioral health unit that will be established on the 3rd floor of the hospital. It will be inpatient. So that means those that are the most vulnerable, those who have the highest critical need of care, are going to be able to be taken care of right here in our home, in our hometown. That means that, and I know this because I have a daughter who went through many years ago a similar situation, and we spent many trips back and forth over the years to Salt Lake because we didn't have this service. That means that we have a resource that really will impact so many lives, because just one person recovering, that ripple effect, it touches so many people. This will be for adults. People have asked quite often about pediatrics. Hang on, let's get adults and geriatric as well. So it's going to serve both of those. We're going to get that up and running. And then we're going to be looking at next steps, potentially intensive outpatient. So there's a continuum of care there. We get them inpatient, we get them stable and doing a little better, and then we move them into the less intensive outpatient. Intensive outpatient, less, I'm sorry, they're not inpatient.
They'll be outpatient at
Thank you.
Yes,
yeah.
No, you're fine.
Yeah.
Yeah.
Sorry, I think I muddled that. You get the picture.
Yes, definitely. The inpatient behavioral health unit, again, remodeling begins very soon, and then looking forward to, as CEO Simpson described during the recent meeting, hopefully these things, a lot of it is staffing. And that's one thing, too, that the community benefits report indicated, that NNRH was able to add some 56 independent providers to the community in that last year.
Yes, and that's in addition to, those are the providers that have privileges at our hospital new for 2023. So all of the existing ones, plus another 56, these are people serving our community that are, taking care of the patients in the hospital and out in the community.
Emergency, hospital medicine, general surgery, and cardiology, which is also a critical need.
In fact, we have 2 new cardiologists coming on, Dr. Trong and Dr. Valdez Figueroa. Some of you might recognize Dr. Trong. He's been here before. We are so excited that he has accepted a long-term engagement with us. And Dr. Valdez Figueroa is moving here. He's going to relocate and become part of our community. Both of them are wonderful, warm, caring people, and we're just thrilled that they are going to be joining us.
It's so nice that people realize the benefits, as you said, Dr. Tron, coming back. Hopefully it's because we were able to provide a great quality of life and some great experiences for these professionals who, dedicate so much of their lives to helping us heal.
That's it. Dr. Kelly Blair, we talked about a little bit earlier. I remember when she moved here, and I love to pop into her office, and she'll talk about her boys and the activities they're involved in. It just touches my heart that we have so many good providers in this community, engaging on many, many levels.
In fact, Northeastern Nevada Regional Hospital partners, donates, sponsors so many activities. I don't think I'd have enough time to list them all, but obviously there is a big list if you want to access the Community Impact Report, both online, but ranging from the Boys and Girls Clubs of Elko to the Festival of Trees, the Art Club, Elko Bass Club, Shop with a you name it, the Terrace at Ruby View. These are all amazing partners, and I think, Terry, it is important to emphasize because often there are experiences that people might focus on, and they'll see something on social media and maybe it's not quite true, or there's some misinformation that gets circulated. But there is a beautiful unit of with the new babies and delivering the babies and OBGYN and just getting these families off to a beautiful start. And you're delivering more and more babies all the time. People are finding prenatal care, pediatric care right here conveniently close to home and doing it with confidence and finding a great experience.
I was up there today in our OB unit, visiting with our patients. We, the directors and the leaders at the hospital, we do rounding, is what we call it, checking in with patients all the time. And I've been doing that for, several days now. The feedback is overwhelmingly positive. I get once in a while a blip. Somebody will say, I asked for this and I didn't get it quite yet. Well, sometimes those OB units get busy.
We'll
I can
your
run and
ice
get you
to
some
you.
water. Yeah,
Yes,
I can do that.
Yes.
That's something I'm capable of. But really, we have such good nurses, good doctors, good care there. And they'll tell me, so-and-so from dietary, she was so sweet, she made sure I got this. I mean, that is really the impact, I think, of a hospital that is large enough to have some really high-quality services and small enough to be so caring, so individual.
I'm glad that you brought up that it was people too, Terry, because I just can't help but think of when Olivia was born, and that was kind of a town experience because, you're a public person, and that was at the old hospital there on College Avenue, and Olivia was delivered there by a woman who's now retired, and I saw her in the grocery store just maybe a week ago, and it's the people. She asked about Olivia specifically, who now is graduated from college and working as a professional in Arizona. And that's the kind of community we live in. It didn't matter to me that was the old hospital that Olivia was born in. And, now we have this beautiful brand new facility that people can actually practice in and have their babies and experience some of these times in their lives.
We do.
The worst and the best times, right?
Yes, yes.
Realistically.
I love the pediatric, that pediatrics, I'll go in sometimes, just seeing how tender Dr. Featherstone is with our little patients, even if they're there for something that's really hard. Mm-hmm. The expressions of gratitude from family members and parents, on med-surg, on all our wards. It's really touching to me because at that moment in your life, when you or your loved one is going through something hard, it's about you. It's about what you're feeling and how you're hurting or how you're trying to cope with their hurting, and that gratitude that someone is genuinely working so hard to help you. And it's even the like when I was working at the health fair a couple of weeks ago. We did over almost 1,100 blood draws, so people could get free lab work back, something to visit with their primary care and indicators of any health issues. Just the expressions of gratitude from them saying, I'm so glad you guys are willing to do that. It's that outreach that makes my job I love it. I love it. It's so satisfying.
Thank you so much, Terry. Again, we are talking with Terry Clark from the Northeastern Nevada Regional Hospital right here on the doorstep of their first in a series of women's wellness events. This event is coming up on Friday, April 12th. And in the meantime, visit the hospital website, look over the Community Impact Report, visit with someone who's had an experience at the hospital, but find out for yourself. And it's an old expression, but you really get what you give. And if you go into something, with a positive, an open mind and an open heart, you'll probably come away with some factual information, right? I mean, this is, I
love that. Thank you. Yes.
Well, we're just trying to help people understand. We have a resource that's available right here in the community, and you can help make that experience better if you can help participate and be involved in your healthcare in a positive way. So, Courtney, thank you so much for being on the program too.
Absolutely. Yeah. I'd like to add real quick if we have a second.
Of course.
I'm a former employee of the hospital. That's how Terry and I connected and started working together first. And when I was working in the hospital, I felt the same way. I felt this is such a good place to work. It's a great place for our community to have access to. People here are good people, and they take really good care of the community. And then I moved out as a community member, and I'm as an outsider per se now. My mom was affected in November and was treated very well by the ER staff. They stabilized her. She was in very critical condition, stabilized her before she was flown over to University of Utah. And that was NNRH. That was the ER group that took care of her. So I can say now as a community member that our hospital is a good hospital and they do take really good care of our community.
Thank you, Courtney, so much. Again, we hope to hear more of these heartwarming and positive stories because they really do outnumber the unfortunate circumstances and situations that people sometimes find themselves in. And we sympathize with that. I know I do. But I can honestly tell you that of the numerous occasions that I've had, whether with a loved one, someone I care for, just direct care, going to Northeastern Nevada Regional Hospital, I have never had a bad experience. I just have never had one. So,
Oh, I'm so glad. Do you know we have a motto up there? You'll hear our Count on Us ads, but the motto inside the hospital is Count on Me. And I really try, and we really try. We live it.
thank you, Terry. Terry Clark and Courtney Nalivka, our guest today here on Elko Live on KELK. Make sure you reach out to NNRH and get signed up for the first ever Ladies Night Out coming Friday, April 12th.